Chapter 12, Therapy. Psychotherapy uses psychological methods that include a personal relationship between a trained therapist and a client. Remember, you cannot represent yourself as a counselor or a doctor without having the specialized training. It's one of those practices that they've made illegal in our court system. Biomedical therapies are treatments of psychological disorders by altering the brain's function with a physical or chemical intervention. The following three mental health professions provide most of the therapy: psychiatrist, social work, and psychology. Those are the three main areas that you would go in to have to meet with a health professional. A psychiatrist is a medical MD that can prescribe medicine. A social worker and a psychologist both can have PhDs, neither one can prescribe medicine. Founded by Sigmund Freud, asserts that all psychological disorders stem from the unconscious forces. We have what is known as free association. It is a technique where the client says out loud whatever comes to mind. I'm feeling angry today. I'm sad. I'm happy. And there can be a word association. Mom. Bad. Good. So they'll say a word and then whatever comes out, then there is. Transference occurs when a client develops feelings towards a therapist that may reflect feelings towards others. People can fall in love with their therapist. Not a good idea. At that moment, when the counselor realizes that, they should be pushing you to a different therapist. They should end your sessions with you and move you on. Falling in love with a client or the client falling in love with you can be dangerous for both. Countertransfer is when the therapist develops feelings for the client and may reflect feelings for others. Sometimes you'll have a client that is very empathetic to a child that they're in custody for, that they want to protect it. They'd like to be their mom. There's been different things that come out. Either case, transferent or countertransferent, the counselor needs to be switched for the safety of the client and the counselor. Resistance is anything that the client does to interfere with therapeutic process. A lot of times they'll cancel their appointments. They'll show up 30 minutes late. They'll become very abusive. When things are hard and you're dealing with hard issues of psychotherapy, a lot of times the clients do not want to be there and they stop things. Psychodynamic therapy can be two things: very extensive and for a long period of time, which makes it very expensive. Okay, depending on who you go see, a lot of therapists charge usually $50 to $250 a pop. Sometimes your insurance pays for it, sometimes it does not. There's usually a copay with it, and depending on your insurance company, whether or not they will pay for that, what your copay would be. Behavior therapies applies learning principle to elimination of unwanted behavior. Counter-conditioning procedure involved in conditioning a new person's response to stimulus that triggers unwanted behavior. Systematic desensitization, technique in which the client is gradually exposed to the fear object. So if you are afraid of escalators, we will have you be around escalators until we finally get you to go on an escalator while it's moving. Okay? That can be very hard for people. Response prevention, a technique in which the clients are exposed to a situation in which they exhibited a compulsive behavior and cannot engage in it, like washing their hands over and over again. For somebody with COPD, with obsessive compulsive disorder, turning the locks over and over again. Remember Sheldon from Big Bang Theory. Penny, Penny, Penny. He has to keep doing that. It's a compulsiveness. And if she interrupts him at any time, you watch him in those episodes, Switch back to, hey, I've got to do this again. I've got to do this again. It's got to be 3 times, and I have to knock and say the name, knock and say the name. Operant conditioning involves learning through the reinforcement and punishment. Token economics involve reinforcing desired behavior with tokens that can be exchanged for other forms of reinforcement. It can use to shape behavior. You know, if a kid does something good, you know, if you're good in the store, I will give you a candy bar. If you go to school with from now until the end of the year without missing a day of school, I'll, you know, buy you a bike. Observable learning. Social learning theory explains that people learn social behavior through observation and cognitive processes. Okay? That every time we interact in a social setting, we are learning new behaviors. Sometimes you're learning the behavior not to display. You know, when somebody's acting a fool, you're like, oh, don't do that. You look kind of weird. Modeling, technique in which desirable behaviors are demonstrated as a way of teaching them to clients. Being polite, yes ma'am, yes sir, please and thank you. Being on time, being respectful when other people are talking. All of those things are important. Social skill training, technique in which the clients are taught how to interact with others more comfortable and effectively. They do a lot of, you get a chair out and the therapist represents whoever you're angry with, and you model what the conversation's going to be over and over and over. I am angry because. They don't want you to use you messages in that. Anytime you're mad at somebody, try to use I feel, not you are. Gives you more power with the I feel than the you are. Cognitive therapy focuses on identifying and then modifying dysfunctional patterns of thought. And this is, again, why people practice what they're going to say in emotional settings so that they come across as clear and non-dysfunctional. Rational motive behavior therapy, a therapy in which people are confronted with their irrational beliefs and are persuaded to develop a more realistic way of thinking. You know, if you know, oh, what's a good one for this? Wanting to hurt somebody. And a more realistic way would be to what are you aggressive about? What are you upset with? You know, and sometimes it works, sometimes it doesn't. Cognitive behavior therapy, a therapy that identifies when changes negative thinking and behavior by using cognitive and behavioral principles. Giving them steps on how they can be heard. You know, sometimes they tell a client, please talk in the mirror on how you want to say to somebody, but make sure you're saying please and thank you, and you're not bogging down other items, especially in couples therapy. You know, it's easy to remember every fight you've ever had, but stay in the moment. What are you upset about at this moment? What is the issue at this moment? Not that they didn't do the dishes 10 months ago. Humanistic therapies. Humanistic therapies focus on helping people get in touch with their feelings. Why am I sad? What is going to make me feel better? Client-centered therapy. A therapy in which the client directs the course of therapy. So if you come to my office and you tell me that your head hurts, then that would direct me to say, so every Wednesday that you've come into my class, your head is hurt. Then we're going to talk about it that way. Or they'll say, oh, you know, I'm feeling lonesome today. So then you talk about that topic. It's really great when counselors or therapists use a technique called open-ended statements to broaden the conversation. When it's cloudy outside, there is an apparent sense of loss. Describe the loss to me. That's an open-ended question. They're going to describe the loss. Okay, so there's going to be more than yes or no. Reflection, a technique in which a therapist acknowledges an emotion that the client is expressing. I see you're angry today about not being heard. Paraphrasing. Every one of you need to learn how to paraphrase. Okay? You summarize what you heard somebody say and paraphrase it back to them. I hear that you're angry about the weather today. And then that way they can acknowledge whether or not. It also makes people feel that you're listening to them. Gestalt therapy, a therapy that stresses awareness of feelings in the here and now. It encourages a client to become aware of feelings and impulses that they have disowned. Are you angry about something? What can we do? Empty chair technique, we talked about that just a few minutes ago, where they place a chair or a person in that chair and the client imagines that the other person is there that they want to talk to. This helps a lot in issues of rape, sexual misconduct from an adult that's in jail, a loss of a parent, okay, where you don't always want the feedback of the person that had done something, but then you stress all the feelings that you're having with that person. Group therapy, simultaneous treatment of several clients under the guidance of a therapist. Group therapy can be super good, especially if the therapist that's running the group allows the other group members to really keep them in check, you know, where instead of the counselor calling out somebody saying, you know, you're out of line, you shouldn't act like that. It can't be too much where you get too much tension in the group, but it becomes very good if you can have a group session where people feel invested and it's a good working relationship as clients. Family therapy, designed to constructively modify dysfunctional relationships among family members. Every family is dysfunctional, whether we like it or not. Some are more dysfunctional than others. And some people have to go to counseling to figure out how to work it out, okay? Because maybe you're not listening. Maybe they're not listening to you. And having a third party there can help modify issues. Couples therapy, designed to help couples improve the quality of their relationship. Not always a good thing either. Sometimes it's very good for couples, but both have to be willing to go. If only one is going, you're not going to see great results. Biomedical therapies. Antipsychotic drugs work by blocking the dopamine, clorazine, clopamine, reprenisone. Antidepressant drugs work by increasing norepinephrine and serotonin, the MAOIs and the SSRIs. Okay, these drugs, sometimes you want to block dopamine and sometimes you want norepinephrine or serotonin to increase to make people feel happier. Anti-anxiety drugs work by inhibiting the GABA, benzodiazepine. We also have done what is called electroconvulsive therapy, ECT, a treatment where the brief electric shock is administered to the brain. You know, I wouldn't want that done, but people have. Psychosurgery destroys brain tissue that's thought to cause the disorder. Deep brain stimulation, a technique using a mild electronic stimulation to regions of the brain. Economical and social trends. Managed healthcare has an advantage, disadvantage for mental health treatment. Documents of mental health treatment is increasing. Ethical minorities in the United States are less likely to seek mental health treatment, and it gives a different power play in the United States because of that. Wealthy people tend to go get mental help for drug and alcohol treatment, for family counseling, and they're getting the needed meds. Poor people can't afford the meds, so they don't go get help. And then it's a vicious cycle because they might lose their kids, they might lose their housing because they go into a psychotic rage. I'm going to add a clip on here of a couple videos I want you to watch, so make sure you go ahead and do that and read chapter 12.